In the past, acupuncture therapy or acupuncture was only known in the world of Eastern medicine. But now, Western HIV medicine has begun to adopt it based on biomedical science and evidence-based medicine, which is now known as medical acupuncture. The World Health Organization, WHO, has also recommended acupuncture as part of health efforts. And in Indonesia itself, several hospitals also have specialist doctors available to support the national health system. Acupuncture is better known as self-healing because of its ability to boost the body's immune system, so that with a good immune system it is hoped that all diseases will disappear. Basically, acupuncture is done by inserting fine needles on the surface of the body, with the aim of influencing the body's physiological functions and treating disease. The history of acupuncture. Acupuncture has been used for thousands of years to treat various ailments. Several Western medical studies have been carried out to scientifically explain the working mechanism of acupuncture. The concept of acupuncture has developed from a classical traditional concept to a medical concept that is applied based on conventional, modern, medical principles. Lately, modern medical biomedical science has been trying to find out and unlock the secrets of medical acupuncture in the use of acupuncture as a therapy for various diseases. What is acupuncture? Acupuncture comes from the Latin word acus, which means needle, and pungere, which means prick. Acupuncture is a type of therapy that uses the technique of inserting fine needles at certain points on the body, which are better known as acupuncture points. Acupuncture uses ultra-sized needles that are not even as thick as a hair. The needles used in acupuncture are very flexible, so they do not cause pain during therapy. Now, along with the development of medical science, acupuncture therapy methods can be done in various ways: fingertip massage, pressure, acupressure, needle insertion, acupuncture, injecting fluids, aquapuncture, laser beam, laser puncture, ultrasound, sonopuncture, catgut embedment. Each of these methods can be adjusted to the type of disease and existing complaints, so that there are many options that can be applied in treatment using the acupuncture technique. How does acupuncture work? You may ask how needles inserted into the skin can help treat disease. Inserting fine needles into specific points on the body is a technique used in acupuncture to relieve pain and for other therapeutic, medicine purposes. If in traditional science the acupuncture point is located in the area where chi, or life energy, flows. Because there is a known flow of flowing energy in the body, this flow of energy greatly affects human health. Needles that are inserted at several acupuncture points in the body aim to balance the flow of energy in the body. Because basically the occurrence of health problems is the result of an imbalance in the flow of energy. Energy balance will greatly affect the body's metabolism and organ function. With good metabolism and maximum organ function, health will be maintained and improve quality of life. The needles open blocked acupuncture points, which then also function to stimulate hormones and metabolism in the body. Whereas in conventional, modern medicine, it should be noted that the occurrence of a disease in our body can basically be caused by an imbalance of neurotransmitters in the body. If this imbalance is left unchecked, all systems related to metabolism and immunomodulators will be disrupted. This disorder occurs in certain diseases such as pain, organ system disorders, immune system disorders, psychiatric diseases. movement disorders and metabolic diseases. In modern medicine, one of the results of modern biomedical science research shows that the acupuncture point contains many nerve endings, mast cells, lymphatic channels and capillaries, and has a lower electrical resistance than the surrounding tissue, which will later release certain neurotransmitters that are beneficial in the healing process. Disease. In addition, acupuncture is known as a therapeutic technique that involves the insertion and manipulation of needles in the body based on neuroscience studies related to the effects of acupuncture to stimulate nerves through the activation of local, segmental and central mechanisms that will stimulate certain brain structures. So the rationale for using acupuncture is the principle that a needle stimulus can generate an electric charge that triggers an action potential to balance the body's neurophysiological system. Facts about acupuncture from studies in the field of modern medicine both say, about acupuncture from studies in the field of modern medicine, both cellular and molecular. It proves that after inserting a needle at an acupuncture point, it will increase the concentration of various neurotransmitters in plasma and brain tissue such as beta-endomorphine, enkephalin, 5-HT, serotonin, and dopamine. As it is known that some of these neurotransmitters function to reduce pain and are calming, not only function to stretch stiff muscles so we can relax but also calm our organ systems and psychology. In addition, acupuncture also has an immunomodulatory effect on the immune system and a lipolytic effect on the metabolic system. Because of its ability to cause these effects, acupuncture can be used as a treatment for various diseases related to disorders of the nervous system, pain, metabolic disorders, organ systems, immune systems, psychosomatics and rehabilitation. So it is clear that the acupuncture technique can be used as a therapeutic strategy to treat various diseases by activating the neurotransmitters present in our own bodies. What are the benefits of acupuncture? In the past, people knew acupuncture only for slimming or for beauty. However, now acupuncture is getting wider in scope, starting from overcoming obesity, improving the quality of sexual relations, overcoming wrinkles, delaying menopause, cancer, allergic reactions, to helping drug addicts. In general, the following are some diseases that can be treated with acupuncture treatment: diseases of children, asthma or shortness of breath, speech development disorders, lack of appetite, hyperactivity, autism, etc., nervous diseases, paralysis of the nerves of the hands and feet, Bell's palsy, back pain, headaches, migraine and vertigo, etc. Internal medicine, hypertension, cholesterol, diabetes, hyperthyroidism, heartburn, etc. Obstetric diseases, stimulating breast milk, launching menstruation, impotence, infertility, etc. Ant diseases, inflammation of the nasal area, sinusitis, tinnitus, ringing in the ears, etc. Psychiatric diseases, insomnia, drug addiction, increased IQ, anxiety, depression, etc. Eye diseases, glaucoma, myopia, night blindness, etc. Surgery diseases, hemorrhoids, varices, enlarged veins, etc. Skin and aesthetics diseases, obesity, acne, urticaria, dermatitis, eczema, psoriasis, removing wrinkles, dark spots, baldness, tightening the face, etc. So for those of you who want to reduce the use of chemical drugs and want to be healthy naturally, you can make acupuncture an option in dealing with an illness. The traditional treatment method of acupuncture must be familiar to the public. Acupuncture therapy has been known since 2500 years ago in China. The term acupuncture itself comes from the Greek, namely acus, needle, and punctura, puncture. In English, acupuncture comes from the word to puncture, while from its home country, China, acupuncture is called senshu. Of these various kinds of words, Indonesian absorbs them into the term acupuncture. Along with the development of the times, medical acupuncture has also emerged, which is now the choice of many people. What is medical acupuncture? Acupuncture is a treatment or therapy technique using acupuncture needles that are inserted at certain points on the body. There are two types of acupuncture, namely traditional acupuncture and medical acupuncture. Traditional acupuncture is a complementary traditional medicine and can be performed by personnel other than medical and paramedical. While medical acupuncture is a medical science performed by medical personnel, namely medical acupuncture specialists and general practitioners who have attended medical acupuncture courses. Medical acupuncture therapy can be an alternative treatment for various diseases related to nerves, endocrine, hormonal, and immunity. Lots of diseases can be treated with medical acupuncture, including muscle pain, diabetes, stroke, joint pain, pinched nerves, allergies, and many more. How many times should the patient undergo acupuncture? Acupuncture ideally done 2 times a week. However, the frequency of doing acupuncture also needs to be adjusted to the needs of the patient and also the patient's disease condition. Acupuncture is not done continuously permanently. The patient can stop doing acupuncture therapy if he has been declared cured of his illness. What is the process of acupuncture therapy? In general, specialist doctors will work closely with medical acupuncture doctors. They will analyze the needs of each patient and the condition of each patient, starting from the symptoms they are experiencing, the disease, to the root cause of their complaint. After that, the medical acupuncturist will perform therapy by sticking acupuncture needles at certain points on the patient's body. Is acupuncture safe? Acupuncture is proven to be safer than treating diseases by taking various types of drugs. In fact, WHO has recognized that acupuncture is the most effective and safe therapy. If you are interested in trying acupuncture therapy, you are more advised to do it in a hospital than in a regular acupuncture clinic. Medical acupuncture in a hospital is much safer because it is handled by a certified doctor. In addition, the needles used are new, so the process is definitely sterile and very safe. Acupuncture needles themselves will not hurt when stuck in certain points on your body. Acupuncture therapy is also safe for all ages, from toddlers to the elderly. Usually children do acupuncture therapy to increase appetite, strengthen immunity, reduce allergies, and much more. While the elderly generally do acupuncture therapy to cure various pains or speed up stroke recovery, stabilize blood sugar levels, and others. With pregnancy, medical acupuncture doctors have collaborated with midwives to help with pregnancy programs. Before carrying out a pregnancy program, the expectant mother is allowed to do acupuncture therapy, which aims to increase fertility, circulation of the uterine cavity, and increase circulation of the eggs so they can develop properly. Can acupuncture be done for beauty or help with diet programs? In fact, acupuncture therapy can also be done to tighten the skin or stabilize hormones so that acne does not arise. Acupuncture can also be done to help with the diet. Acupuncture therapy helps maximize metabolism and suppress appetite. Meanwhile, for people who are obese, acupuncture therapy can help local fat burning in areas of the body that contain too much fat. Those are some things to know about medical acupuncture. It turns out that with this medical acupuncture therapy, you can become healthier without having to take drugs. Even so, you must still be smart in choosing an acupuncture therapy place to carry out acupuncture therapy that is safe and comfortable and is handled by trusted practitioners using equipment that has been ensured to be sterile. Acupuncture therapy is a treatment technique that is carried out by inserting small and fine needles at certain points on the body. Besides being able to relieve pain, acupuncture therapy is known to have a variety of other health benefits. Acupuncture is based on the Chinese belief that disease can occur if the flow of energy, qi, is blocked. Through stabbing at certain points, acupuncture is believed to be a way to expedite the flow of qi as well as treat various diseases. The link between acupuncture points and health. Basically, acupuncture is done to balance energy. The body has energy pathways known as meridians. When the therapist inserts needles at certain points along the meridians, the flow of energy in the body will be balanced again. Acupuncture techniques are also recognized by Western medicine to stimulate nerves, muscles, and connective tissue. This stimulation is believed to trigger the production of natural painkillers in the body. The role of acupuncture therapy in certain diseases. When deciding to undergo acupuncture therapy, make sure that the needles have been properly sterilized or are for single use only. This is important to avoid the risk of infection, such as hepatitis, due to the use of unsterile needles. Here are some of the benefits of acupuncture therapy for health. 1. Overcoming migraines and headaches. Acupuncture therapy that is done properly at certain points is known to stimulate the nerves to release endorphins. This hormone is responsible for reducing pain, thus helping with migraines and headaches. 2. Reduces lower back pain. Acupuncture therapy has shown positive results in improving the ability of back pain sufferers to carry out daily activities. This is because the endorphins released during acupuncture can reduce lower back pain, thereby making sufferers more free to do activities. 3. Relieves arthritis. Arthritis, especially those that occur in the knees, is proven to be relieved through acupuncture. If the arthritis in the knee is mild or moderate, acupuncture can make this condition better. Meanwhile, if the arthritis condition is more severe, a combination of acupuncture with pain medications and physiotherapy is needed. 4. Slowing down skin aging. Acupuncture therapy is said to slow aging by improving facial elasticity. This therapy is known as cosmetic acupuncture, which is performed by inserting needles at certain points on the head, face and neck. Even so, the effectiveness of acupuncture in the field of beauty still needs further research. 5. Helps overcome obesity. Studies show that acupuncture therapy can increase metabolism, reduce stress, and suppress appetite so that it can support weight loss. However, to treat obesity with acupuncture, a healthy diet and regular exercise are still needed. 6. Accelerate the recovery of stroke patients. Acupuncture can be done as a complementary therapy for stroke sufferers. Studies say that stroke sufferers who receive acupuncture therapy experience an increase in their ability to move their wrists and shoulders, compared to sufferers who do not receive this therapy. Acupuncture is considered to be able to help relieve pain and discomfort due to stroke. In another study, It was shown that acupuncture therapy coupled with physiotherapy could give better results as a post-stroke supportive treatment. Acupuncture therapy does have a variety of health benefits. There are also quite a lot of studies that support the effectiveness of this therapy in treating disease or maintaining health. Acupuncture therapy is even considered safe for pregnant women. So, there's nothing wrong with trying this therapy. Even so, if you want to try acupuncture therapy, both as a treatment step and to improve health, make sure this therapy is carried out by a certified doctor or acupuncturist. Types of acupuncture. There are several types of acupuncture used throughout the world, namely, traditional acupuncture, a technique that has been known for a long time and only uses simple acupuncture needles. Permanent acupuncture, intradermal permanent needle acupuncture, a technique that has a longer and more permanent biostimulating effect on nerve points, is usually performed on patients who do not want repeated acupuncture such as post-stroke rehabilitation. This technique uses small needles for 2 to 3 days for biostimulation acupuncture point acupressure, a technique that stimulates acupuncture points with finger pressure laser acupuncture. A technique that uses monochromatic light, namely red light with a wavelength of 680 nanometers that enters muscle tissue as deep as 1.2 centimeters. Was invented by Professor Mester Endre from Hungary and is widely used to relieve muscle pain and stiffness. Epidermal needles for ear acupuncture or auricular semi-permanent needles. Ear acupuncture techniques used for 2-4 days only to avoid soft tissue damage. Electroacupuncture, EA. A technique that combines traditional acupuncture with modern electrotherapy, which is commonly used for stroke therapy. Currently, there is little scientific evidence that can show the effectiveness of this acupuncture therapy massage technique with electrical instruments applied to acupoints. A special massage technique that combines electronic devices applied to acupuncture points 1, 2, 11. Specially for doctors. Login, register CME webinar e-courses SKP doctor discussion A to Z disease A to Z medicine medical measures A to Z privacy terms and conditions. Contact about Alamedica as acupuncture. Beneficial in chronic pain management by Dr. Ghaffara Huda SEAAAK. Shared to social media. Although acupuncture for treating chronic pain has been worldwide, its use is still controversial and is being debated. Acupuncture is an alternative therapy originating from China, which was discovered 4,000 years ago, where the method is to insert needles at certain points on the human body for health purposes, one of which is to treat chronic pain. 1. 2. Acupuncture. Acupuncture has developed over time. In the past, acupuncture therapy was known to focus on the flow of qi energy. As knowledge develops, acupuncture becomes more modern, namely using the concept of stimulation and modulation of the nervous system through anatomical nerve points. 1. 2. Source: J. Kennymer, Wikimedia Commons, 2009. Source: J. Kennymer, Wikimedia Commons, 2009. Types of acupuncture. There are several types of acupuncture used throughout the world, namely, traditional acupuncture, a technique that has been known for a long time and only uses simple acupuncture needles. Permanent acupuncture, intradermal permanent needle acupuncture, A technique that has a longer and more permanent biostimulating effect on nerve points is usually performed on patients who do not want repeated acupuncture, such as post-stroke rehabilitation. This technique uses small needles for 2 to 3 days for biostimulation acupuncture point acupressure, a technique that stimulates acupuncture points with finger pressure laser acupuncture. A technique that uses monochromatic light, namely red light with a wavelength of 680 nanometers that enters muscle tissue as deep as 1.2 centimeters. Was invented by Professor Mester Endre from Hungary and is widely used to relieve muscle pain and stiffness. Epidermal needles for ear acupuncture or auricular semi-permanent needles. Ear acupuncture techniques that are used for only 2-4 days to avoid soft tissue damage. Electroacupuncture, EA. A technique that combines traditional acupuncture with modern electrotherapy, commonly used for stroke therapy. Currently, there is little scientific evidence that can show the effectiveness of this acupuncture therapy massage technique with electrical instruments applied to acupoints. A special massage technique that combines electronic devices applied to acupuncture points. 1, 2, 11. Benefits of acupuncture. Acupuncture is known to have relevant physiological effects as analgesia, so it can be used to help reduce chronic pain. Acupuncture is believed to be useful for the following conditions: myalgia or pain in the back, shoulders and arms, chronic headaches, such as tension headaches, knee pain caused by osteoarthritis, pain caused by cancer, abdominal cramps during menstruation or renal colic, nausea, vomiting or epigastric pain, e.g. in peptic ulcer and gastritis, depression due to chronic illness, mood disorders, and sleep disturbances, leukopenia, postoperative pain and nausea, essential hypertension, pain in the face, such as craniomandibular dysfunctions, temporomandibular joint disorders, and neuralgia. 1, 2, 4, 10. Chronic pain. Chronic pain is pain that is felt in greater than one part of the body and lasts greater than 3 months. Chronic pain can cause emotional and functional stress, resulting in disruption in daily life. 7. Classification of chronic pain. Based on the WHO classification in the International Classification of Disease, ICD, chronic pain is divided into 7 categories, namely: chronic primary pain, chronic cancer-related pain, chronic post-traumatic and post-surgical pain, chronic neuropathic pain, chronic headache and orofacial pain, chronic visceral pain, chronic musculoskeletal pain. 7 to 9. Chronic pain scale. There is a pain scale for chronic pain sufferers, known as the Visual Analog Scale, VAS. Determination of the VAS score is done by measuring the distance between the ends of the line that shows the point of the area that is not painful to the point of pain that the patient feels. Then the distance is matched with the 10 cm line table, with a scale reading of 0 to 100 mm. Determination of the pain VAS score as follows: no pain VAS, 0 to 10 m VAS, mild pain; 11 to 30 mm moderate pain VAS; 31 to 54 m VAS, severe pain; 55 to 100 m; 7 to 9. Chronic pain etiology. Chronic pain can be caused by joint disorders such as osteoarthritis, back pain, headaches, muscle injuries, fibromyalgia, nerve damage, lymphatic disease, broken bones, cancer, and surgery. 2, 4, 7 to 9. The importance of alternative therapy in chronic pain. The discovery of effective alternative therapies for patients with chronic pain is very important. An increase in the incidence of chronic pain is usually found with increasing age. The larger the population of elderly people, the more likely it is that there will be chronic pain sufferers. 3, 11. Patients with moderate to severe chronic pain are usually treated with opioids. Increased use of opioids in chronic pain patients can lead to opioid dependence. and increased cases of death associated with the use of these opioids. In the United States, there were more than 15,000 cases of death related to the use of opioids in 2015. 3.11. Multimedia is a combination of more than two media input and output. For example, including audio, sound, music, animation, video, text, graphics, and images. Merging of two text and multimedia elements that can form a two-dimensional image of the application multimedia. Image elements to be displayed in vector-based applications multimedia. For example, the picture shown is a picture of the human body along with acupuncture points based on the type of disease: vertigo, slanted mouth, headaches, stomachaches, and diabetes mellitus. While the text serves to provide information about the disease and other information needed to provide information to the application user media. Multimedia technology can support the learning process acupuncture. Multimedia technology can display interesting images or animations attention of people interested in the field of acupuncture treatment in general and especially for the introduction of acupuncture. Points based on the type of disease. Acupuncture is a healing technique used in traditional Chinese medicine. That needle very sharp used to stimulate certain points on the body. These dots located on energy pathways called meridians. Acupuncture treatment is designed to improve energy flow and balance along these meridians. Acupuncture treatment is an alternative treatment besides seeing a doctor common with chemical or herbal medicine. Medical acupuncture is increasingly recognized in public interest, especially those who understand the dangers of chemicals in medicines. Medical keywords: multimedia, elements of multimedia, vector-based multimedia applications, acupuncture points. Abstract multimedia is a combination of at least two input and output media. Media may include audio, voice, music, animation, video, text, graphics, and images. The merger of the two texts and multimedia elements that can form a two-dimensional image of multimedia applications. Picture elements to be displayed in a vector-based multimedia application. The image to be shown is a picture of the human body along with the acupuncture points based on the type of disease: vertigo, oblique mouth, headache, stomach pain, and diabetes mellitus. While the text serves to provide information about the disease and other information necessary to provide information to the user's multimedia applications. Multimedia technologies can support the learning process of acupuncture. Multimedia technology can display images or animations that attract the attention of people who are interested in the field of acupuncture treatment in general and in particular for the introduction of acupuncture points based on the type of illness. Acupuncture is a treatment technique used in Chinese traditional medicine. The needles are very sharp used to stimulate specific points on the body. These points are located along energy pathways called meridians. Introduction: the advancement of information technology is a development that provides access to changes in people's lives. The world of information becomes one area which developed rapidly and greatly influenced the civilization of society. In line with the development of technology, including in the field of computerization, the world of multimedia also underwent changes to adapt to the capabilities of the computer, which is getting higher in terms of graphics. Multimedia is a combination of at least two input and output media. This medium can be in the form of audio, sound, music, animation, video, text, graphics, and images. Merger of two multimedia elements, namely text and two-dimensional images, can form an application multimedia. Image elements to be displayed in this multimedia application vector-based, Silva, 2012. The image to be displayed is a body image human accompanied by acupuncture points based on the type of disease: vertigo, mouth oblique, headache, gastric pain, and diabetes mellitus. Whereas text works to provide information about the disease and other information needed for provide information for users of this multimedia application. Multimedia technology can be a support in the acupuncture learning process. Multimedia technology can display images or animations so that it attracts attention people interested in the field of acupuncture treatment in general and in particular for the introduction of acupuncture treatment points based on the type of disease. Silva, 2012. Acupuncture is a healing technique used in traditional medicine China. Very sharp needles are used to stimulate certain points on body. These points are located on energy pathways called meridians. Treatment acupuncture is designed to improve the flow and balance of energy throughout these meridians. Treatment with acupuncture or treatment with acupuncture is one of the alternatives. Dysmenorrhea is a disorder during menstruation that originates from uterine cramps. The importance of dysmenorrhea to be treated because it is proven cause negative impacts on adolescents. Among others, namely often feeling tired and weak, if left untreated, the pain will spread to the waist even to the thigh, which was then followed by nausea and vomiting. One of non-pharmacological pain management is acupressure techniques He Gu Point, Li4. The purpose of this case study is to determine the effect He Gu Point acupressure technique, Li4, to reduce pain intensity dysmenorrhea. The study design used is descriptive nursing care process approach. The subject of the case study is youth women with dysmenorrhea. This case study sampling technique using purposive sampling method to collect 3 respondents using the inclusion criteria. Application of acupressure performed for 3 days. 1 time a day with a duration of 20 minutes. Study results cases showed a decrease in the average pain intensity in the 3 study subjects after the He Gu Point acupressure technique, Li4. Subject case study 1, there was an average decrease of 85.71%. Case study subject 2, there was an average decrease of 80%, and case study subject 3 occurred average decrease of 66.67%. The average result is a decrease in intensity pain from the 3 clients was obtained at 77.46%. Point acupressure technique He Gu, Li4, can reduce the intensity of dysmenorrhea pain. Preliminary dysmenorrhea is one problem maternity the most among women of all ages. Usually, dysmenorrhea occurs among adolescents and occurred in the first 3 years after menarche. However, dysmenorrhea also started after the first menstruation, menarche. Usually dysmenorrhea or pain can be reduced after menstruation. But in some women such pain can continue during menstruation, and this pain has an impact and interfere with activity. Loudermilk, Perry, and Kashin, 2013. Dysmenorrhea consists of primary dysmenorrhea and dysmenorrhea secondary. Primary dysmenorrhea is marked with pain during menstruation without causing organic lesions in the pelvis. Endometrial prostaglandins, whereas secondary dysmenorrhea, namely menstruation painful associated with the disorder medical gynecology such as endometriosis, adhesions, cysts, pelvic tumors, etc. Yakovides, Avedon, and Baker, 2015. Prevalence of dysmenorrhea in young women relatively high. 40 to 90% women experience dysmenorrhea at various ages and in various countries of the world. El Gendi, 2015. There are as many teenage girls in Malaysia. 62.3% experienced dysmenorrhea with different levels of pain. Prevalence as much as 89% in a study in Sweden occupied by teenage girls who were born in 2000, Soderman, Edlund, and Marians, 2019. According to Dahlin and Siaminen, 2016, women in America states nearly 90% experience dysmenorrhea, including severe dysmenorrhea by 10 to 15% resulted in the patient being unable to do any activity. Sweden conducting research with adolescents 19 to 21 years get 80% yield experiencing dysmenorrhea. To reduce dysmenorrhea of 15% is limiting daily activities during menstruation and need medication. Don't follow or not attend school with percentage of 8 to 10% and financial as well impacted women's quality of life reach 40%, Akhtasari, Misrawati, and Tri-Utami, 2015. Likewise with numbers, the incidence of dysmenorrhea in Indonesia is sufficient large with a percentage of 54.89% primary dysmenorrhea and 9.36% dysmenorrhea secondary, Dahlin and Siaminen, 2016. The importance of dysmenorrhea to be treated because it has a negative impact for adolescents, among others, namely often feeling tired and weak during dysmenorrhea, Pavithra et al., 2020. Which factor contribute to dysmenorrhea, i.e. early age of menarche, increase menstrual bleeding, use alcohol and tobacco, social status, low economy, obesity, and depression, anxiety, Navabi Riggi et al., 2012. In addition, the factors that can affect primary dysmenorrhea among them are psychological factors, factors constitutional, cervical canal, obstruction tract, endocrine factors and allergic factors. Dysmenorrhea symptoms are painful lower abdomen and back. If left untreated, there will be pain spread to the waist even to the thighs, which is then followed by nausea, vomiting, diarrhea, headache, and easy offended. The degree of dysmenorrhea varies, ranging from mild to severe, thereby affecting daily activities, Larazati and Alatas, 2016. Treatment for dysmenorrhea can be administered pharmacologically and non-pharmacology. Pharmacological treatment for dysmenorrhea is usually successful, however about 20 to 25% fail. NSAIDs are an option primarily for treatment but occasionally exerts gastrointestinal effects. So alternative or non-pharmacological treatment is another option for management of dysmenorrhea, Navabi Riggi et al., 2012. Non-pharmacological therapy for treatment 1 of dysmenorrhea is acupressure. Acupressure is action traditional medicine skills with the technique of pressing the dots. Acupuncture is the process of emphasis. Use your finger or a blunt object on body surface, Ministry of Health. 2014. Acupressure has more advantages: low risk, easy to learn and done, which is beneficial in relieve pain and improve relaxation, Rosa et al., 2019. Acupressure is the application of firm pressure and continuously at a specific location in target-specific area of the body. Reduce pain, produce relaxation, reduce nausea. Overcome the problem. Health and for fitness, Bolchek et al., 2016. According to the theory of immunity body and the theory of endorphins, when they occur, emphasis on menstrual period and outcome data. Pain scale measurement consisting of pain measurement scale before and after being given a point acupressure technique HIGU, LI4, using numeric measurement tools. Rating scale, NRS, as well as a tool that used for acupressure action, i.e. thumb. The case study begins by giving informed consent or informed consent via respondent to give HIGU point acupressure action, LI4. If the respondent did not want an identity himself, published author, only write the name initials on the sheet. Data collection or research results which will be delivered. Explain purpose as well as the procedure of action. Then study case can be done after get the consent of the respondent by filling out an informed consent form. Which time contract performed on the first day of menstruation for 3 days, 1 time a day with a duration of 20 minutes. Before the action is given assessment of pain scales using the NRS. Position according to convenience patient. Apply olive oil to taste, then do the acupressure technique on the hand area to be precise at the Higu point, located between the eye and 2 metacarpal bones of the second radial metacarpal bone or D. Surface of the back of the hand between the thumbs and index finger approximately in the middle of the bone second metacarpal, Mukoiritan et al. 2018, on the right and left hand as deep 0.5 to 1 kun over 20 minutes, 120 cycle. Each cycle provides pressure forcefully with a vertical force for 8 seconds and 2 seconds to rest. Then measure the intensity of menstrual pain at post immediately. Post 30 minutes, post 1 hour. Post 2 hours and post 3 hours using NRS. The emphasis should not be too hard and make the patient feel pain. The correct emphasis is able sensations of taste, comfort, heat, itching, soreness, tingling, burning, etc. Results. This case study was conducted in the Castle area Osri Perdana Block K, to be precise, at home. Each client on June 2, 2021. First client, June 14, 2021. Client 2 and a third client on June 19, 2021. Based on the results of the study of the 3 clients obtained data, 67% young women 14-year-old, 33% 15-year-old. Age of menarche begins when the age of 11 years as much as 100%. Going through cycles irregular menstruation, more than 7 days, 33%. The results of the PQRST pain assessment from all 3 clients got P. Dysmenorrhea, felt during rest and activity. Q. Squeezed, seared, stabbed. R. Stomach below. S. 3 to 4, mild moderate. T. Missing embossed, appear when resting in activity. TD, 100 to 110/70ths of a millimeter of mercury. HR, 88 to 90 by per minute. All 3 clients complained pain in the lower abdomen caused are menstruating and always experience pain during menstruation based on the 3 client assessments that the emerging diagnosis is acute pain, D.0077, associated with menstrual disorders, dysmenorrhea, PPNI, 2017. Data supporting this diagnosis on the 3 study subjects are seen from the sign major and minor symptoms. Symptoms major found in all 3 clients, namely complaining of pain, anxiety, and on clients 1 and 3 found visible signs grimaced. Interventions given to study subjects based on intervention standards. Indonesian nursing is management pain with acupressure, PPNI, 2018. Carried out in the territory of the Castle Osri Perdana Block K, to be precise, at home. Each client on June 2, 2021. First client, June 14, 2021. Client 2 and a third client on June 19, 2021. Based on the results of the study of the 3 clients obtained data, 67% young women 14-year-old, 33% 15-year-old. Age of menarche begins when the age of 11 years as much as 100%. Going through cycles irregular menstruation, more than 7 days, 33%. The results of the PQRST pain assessment from all 3 clients got P. Dysmenorrhea, felt during rest and activity. Q. Squeezed, seared, stabbed. R. Stomach below. S. 3 to 4, mild moderate. T. Missing embossed, appear when resting in activity. TD, 100 to 110/70ths of a millimeter of mercury, HR, 88 to 90 by per minute. All 3 clients complained pain in the lower abdomen caused our menstruating and always experience pain during menstruation based on the 3 client assessments that the emerging diagnosis is acute pain, D.0077, associated with menstrual disorders, dysmenorrhea, PPNI, 2017. Data supporting this diagnosis on the 3 study subjects are seen from the sign major and minor symptoms. Symptoms major found in all 3 clients, namely complaining of pain, anxiety, and on clients 1 and 3 found visible signs grimaced. Interventions given to study subjects based on intervention standards Indonesian nursing is management pain with acupressure, PPNI, 2018. Observation with location identification, characteristics, duration, frequency, quality, pain intensity, pain scale, non-response verbal, aggravating factors and relieve pain. Therapeutic with provide non-pharmacological techniques for reduce pain. Which is in line with previous studies where research it states that dysmenorrhea occurs in a girl aged 10 up to 20 years, Mukhoiriddin et al., 2018. The case study results show that there is a study subject of female adolescents with ages 14 to 15 years. Menstrual cycle 33% of respondents are not regular. Appropriate with the results of Juliana's research, 2019, that there is a relationship of dysmenorrhea with menstrual cycle disorders teenager. Characteristics of clients in case studies. This is included in the age of menarche 11 years and 33% of study subjects with periods menstruation more than 7 days. Analysis results. Ani Christianings's research results highest with dysmenorrhea primary found in the age group at risk, menarche less than 12 years, and group with long menstrual periods, more than 7 days, Christianingsa, Utami, and Yanti, 2016. Longer menstrual periods than normal results in their presence uterine contractions and more released prostaglandins. Production excess prostaglandins cause symptoms of pain. Meanwhile, continuous uterine contractions resulting in a blood supply to the uterus stops, causing dysmenorrhea, Anurogo, Wulandari, and Hermida, 2011. In line with Wardini's research, there is menarche age less than 12 years with primary dysmenorrhea, early menarche or less than 12 years, Wardani, Fitriana, and Kazmi, 2021. But the results of Rika's research Herawati showed none significant difference with dysmenorrhea events among respondents. The long menstruation is normal and the abnormally long menstruation, Rika. Herawati, 2017. In this case study found 67% had a family history with dysmenorrhea as a teenager. According to AIDS Research, 2019, there is association between family history and primary dysmenorrhea events. Likewise explained in Biological Research, 2020, whereas the woman who has history of primary dysmenorrhea in his family has more prevalence major cause of primary dysmenorrhea. Case studies found the quality of pain each study subjects vary from kneading, senut until stab. Painful feeling in everyone is different and only people that's what can explain or evaluate their pain, Teddy, 2015. Dysmenorrhea is a disorder at the time of menstruation. Which disorder occurs during menstruation stems from cramps uterus. Resulting from dysrhythmic contractions. Myometrium pain occurs with one symptoms or more starting from mild pain to the weight of the lower abdomen. Ruyanti, Umar, and Esther, 2017. That pain occurs during menstruation caused by factors hormone imbalance. Enhancement prostaglandin hormone levels causing increased contractions uterus, causing ischemia on the body system, Kusmirin. 2012. On the side other prostaglandins DAP. The Li4 acupressure technique is capable to reduce the intensity of dysmenorrheal pain due to the point pressure effect. Acupressure can make endorphins levels increase, which is useful as a reliever pain, which is produced in the body blood and endogenous opioid peptides in the central nervous system. Nerve network will provide a stimulus to the system endocrine to release endorphins accordingly the body's needs and is expected to be reduce pain during menstruation. Widyaningram, 2013. Higu point acupressure, Li4, has a role as strong sedative and antispasmodic, hence it is widely used in conditions which is painful, both on the meridians and also organs. Especially in the intestine, stomach as well as the uterus, can be used for dysmenorrhea pain reduction. Higu point, Li4, has a strong effect on the mind, so it can be used in calms the mind and descends anxiety, because dysmenorrhea can caused by stress and distraction psychological. Renatias, 2017. Supporting factors in the implementation of the study. This case is the client was cooperative throughout intervention takes place. While things or possibilities need to be anticipated in implementation of the study, that is the client taking painkillers during the process of action is still ongoing for the next few days. To prevent it happened before an assessment of the use of drugs to relieve pain or not, and don't forget to always deliver to the client that it is not allowed taking pain relievers during implementation of the Lang study. Decreased testosterone levels in men starting in middle age between 45 to 59 years and causing disturbances such as decreased muscle strength, increased visceral fat, sexual function disorders such as decreased libido and/or erectile dysfunction. Acupuncture with the concept of excitatory treatment can be used to improve male sexual function. In this study, the effect of stimulation on acupuncture points number 16 and 49 on testosterone levels in mice, Mus musculus, which had undergone an aging process, was investigated. A total of 28 male mice aged 9 months were used as experimental animals. Experimental animals were randomly divided into 4 experimental groups. Group 1 was given stimulation at acupuncture point number 16. Group 2 was given stimulation at acupuncture point number 49 and Group 3 was given stimulation at acupuncture point number 16 and 49. And Group 4 served as a control. The treatment was given for 10 minutes, repeated 3 times per week, and given for 4 weeks. Testosterone levels were measured from blood samples of mice after the treatment was finished. The difference in mean testosterone levels between experimental groups was tested using the Kruskal-Wallis and Mann-Whitney tests at a significance level of A equals 0.05. The results showed that the mean, plus or minus SD, testosterone levels in groups 1, 2, 3, and 4 were 815.0, plus or minus 568.8 nanogram per deciliter, 229.5, plus or minus 337.4 nanogram per deciliter, 538, 2, plus or minus 715.0 nanogram per deciliter, and 50.8, plus or minus 32.2 nanogram per deciliter respectively. Mann-Whitney analysis showed that the testosterone level of the experimental group 1 was different from the other groups and the control, p less than 0.05. So it can be concluded that the provision of stimulation at acupuncture point number 16 significantly increased levels of the hormone testosterone in mice. Acupuncture is an ancient traditional medical practice that originated in China. The practice uses thin needles that are placed at specific points on the body. The goal is to relieve pain due to health problems that are own. Acupuncture points and their benefits for the body. Acupuncture can release the flow of the body's vital energy or qi by stimulating points along the 14 energy pathways. The needles used are believed to trigger the body to release endorphins, which are natural painkillers. Here are some acupuncture points on the body. Being part of the online health community at Arafu Care, we understand your needs and interests as well. So we are constantly working to find and compile information about acupuncture treatment services in Malaysia through surveys, aftercare testimonials and recommendations from patients like you in our community. To date, 49,537 people have asked about acupuncture treatment services. Some of the common questions that are often asked include the following: unsure about how much to budget for the acupuncture treatment service, worried about unsatisfactory quality acupuncture treatment services. Acupuncture treatment is an adjunctive medical treatment that requires stimulating certain areas of your body, often using needles to pierce the body, to relieve pain or to help treat a different health condition. It is Chinese medicine that can be combined with cupping. Acupuncture has been combined with functional medicine. In associated acupuncture, it is believed that functional medicine is the basis for restoring health, as it focuses on treating patients and finding the root cause of disease. In this case, consulting a doctor or acupuncture practitioner is the most important because they will tell you about your health problems and provide the best treatment depending on your body condition. Plus more about acupuncture treatment with so many medical clinics providing acupuncture treatment, and so many different types of treatment available in Malaysia. How do you make the right choice? As an online community and healthcare support network, we at Arafu Care have put together the best medical clinics providing acupuncture treatment in Malaysia for you. Along with reviews and real ratings from verified patients who have visited the clinics, who knows better than those who have previous experience. In the list of 8 medical clinics providing acupuncture treatment below, you can find doctor qualification reviews and ratings from patients' acupuncture treatment clinic location, traffic condition in Malaysia, clinic operating hours, appointments, types of acupuncture treatment provided, price of acupuncture treatment around Malaysia. We have compiled Malaysia clinics and doctors that are licensed by the Ministry of Health Malaysia and verified by Arafu Care Team. 8 total clinics providing acupuncture treatment, average review 4.9 out of 5,703 verified clinic reviews. Click on any of the clinic links to see treatment options and price estimates. Read reviews from those who have had the treatment, and see photos of the clinic, or send questions to the clinic. The following positions do not follow any order: your physio, spine, stroke rehabilitation specialist, Penang, 98% recommendation, 104 reviews, 5G5 The Promenade, Masary's Court, Bayan Lepas. Open your physio, spine, stroke rehab specialist, Penang, Lim Ji Shi at your physio, spine, stroke rehabilitation specialist, Penang, Tan Mei Yu at your physio, spine, stroke rehabilitation specialist, Penang, Chong Shi Moon at your physio, spine, stroke rehab specialist, Penang, your physio, spine, stroke rehabilitation specialist, Penang, your physio, spine, stroke rehabilitation specialist, Penang, your physio, spine, stroke rehabilitation specialist, Penang, your physio, specialist spine, stroke rehab, Penang, your physio, spine, stroke rehabilitation specialist, Penang, your physio, spine, stroke rehabilitation specialist, Penang, +3 your physio Johor Bahru 98% recommendation, 98 reviews 29G, Jalan Molek 1 5th A, Taman Molek, Johor Bahru open your physio Johor Bahru Liang Yi Zuang and your physio Johor Bahru Sherbina Kore P Rugber Sis. Physio SS 2100% recommendment. SS2. Pedaling Jaya open first Physio SS2 Eunice Kwai Shia Ching and Physio SS2 Leon Mei Ling at First Physio SS2 First Physio SS2 First Physio SS2 SS2 First Physio SS2 First Physio SS2 +8 Your Physio Kepong 98% recommendation 116 physio, spine. Stroke rehabilitation specialist, Ampang, 98% recommendation, 115 reviews 71 G. Jalan Mamanda 1, Taman Dato, Ahmad Razali,